I want to ask, must be one moment in our life that have seen people around us who have physically abnormalities, right? This happened due to a process called mutation or aneuploidy. What is aneuploidy? Aneuploidy is a condition in which an organism has an abnormalities number of chromosomes in its cells. In human, the normal number of chromosomes is 46. But if there are more or fewer than 46 chromosomes, it called aneuploidy. This can occur due to the error during cell division, and it can lead to various health problems, depending on which chromosomes are involved and how many copies there are. Some common examples of aneuploidy include Turner syndrome, Down syndrome, and Klinefelter syndrome.
Monosomy is a chromosomal disorder in which an individual has only one copy of a particular chromosome instead of the normal two copies. This can occur as a result of a missing chromosome in a pair or a chromosomal division. Monosomy can lead to a variety of health issues depending on which chromosome is affected and can sometimes be fatal. Some examples of monosomy are Turner syndrome, which is caused by the absence of one X chromosomes in female. So, what is trisomy? Trisomy is a chromosomal disorder in which an individual has three copies of a particular chromosome instead of the normal two copies. This can occur as a result of a third copy of a chromosome being present in a pair, or chromosomal duplication. Trisomy can lead to a variety of health issues depending on which chromosome is affected. Some examples of trisomy are Down syndrome, which is trisomy 21, and also trisomy 18, trisomy 13, and trisomy 16. Klinefelter syndrome is also a trisomy disorder, especially a sex chromosome trisomy. It is caused by the presence of an extra X chromosome in males.
Hi, according to Malaysia Health Ministry, Klinefelter syndrome is the most common sex chromosome abnormality, affecting about 1 in every 500 to 700 men. Klinefelter syndrome was first discovered in 1942 by a young doctor in Philadelphia called Harry Klinefelter. He described 9 men who had breast development, small testicle with no sperm in their semen. Klinefelter syndrome is a chromosomal condition that affects males who are born with at least one extra X chromosome. Most males with Klinefelter syndrome, also called XXY males, have 2 X chromosomes instead of 1. Klinefelter syndrome usually characterized by undescended testicle, weak muscle, delay in speaking, slow motor development, and many more. Klinefelter syndrome can lead to weak bones or osteoporosis, varicose veins, increased risk for breast cancer, and many more. There is no cure for Klinefelter syndrome, but typically Klinefelter males live a successful and normal lives.
Turner syndrome. Alright, Turner syndrome is a condition that affects only females, result when one of the X chromosome is missing or partially missing. Turner syndrome can cause a variety of medical and developmental problems, including short height, failure of the ovaries to develop, and heart defects. Turner syndrome might be diagnosed before birth, during infancy, or in early childhood. And the causes of the Turner syndrome is because most of people are born with 2 sex chromosomes. Males inherit the X chromosome from their mothers and the Y chromosome from their fathers. Females inherit 1 X chromosome from each parent. In females who have Turner syndrome, 1 copy of the X chromosome is missing, partially missing, or changed.
Remember, sometimes life does not give you what you want, not because you do not deserve it, but because you deserve so much more. That's all.